Dr. Weiss, thank you for being here today. We're excited to talk about robotics and the role that robotics play in cardiovascular medicine. You're going to be involved in some sessions at Heart Rhythm Society focusing on robotic medicine. Tell us a little bit about that.
Sure. For the first time in recent years in particular, and really for the first time ever, we now have an official society for cardiac robotic navigation called SCRN. It's actually an outgrowth in America, so SCRN-A covering North America, of a European society that was officially developed and put together last year, also hoping to bring in Southeast Asia before long. I have the honor of sitting on the board of that society, and that's really derived from the fact that here at Intermountain we do a tremendous amount of robotic work in electrophysiology. The current state of the art involves a robotic magnetic navigation system known as stereotaxis, with which we have done hundreds of procedures over the last 8 years. We're currently the most experienced group in using this technology in the Western United States, probably close in the entire United States actually. And we routinely host visitors from all over the country and all over the world, in fact, to learn about the uses of this technology. On the Tuesday afternoon before the official session starts, there is an official symposium that's going to be 4 hours of academic presentations made by both American and European leaders in this area. I'm giving 2 lectures during that. There will be a live case presentation as well from one of the hospitals in Chicago, and I'm also moderating a session later on. In addition, on Friday, midday, there's the Rhythm Theater down on the exhibition floor, and I will again be lecturing there during a 1-hour session about robotics in cardiac electrophysiology. We think this is a tremendously interesting area going forward. If you think about any type of technological activities being done these days, both in medicine and otherwise, I think it's pretty clear that taking human error out of the picture will be essential to having the best outcomes in the long run. For instance, if you think about automobiles, nobody races a manual transmission car anymore, right? They just don't work as well. And I think all of us feel that in electrophysiology, or many of us anyway, that in 10 years from now, 15 years from now, we're not going to be doing the procedures with our own 2 hands in the same way that we are now. We'll always want to be able to harness our intellectual expertise in directing what goes on, but taking the variability of the human hands out of it will actually help improve patient safety and patient outcomes. So this society is really all about exploring the current technologies, growing those technologies towards the future, and investigating the newer technologies that may drive that as time goes on. So it's a very exciting thing. This is the first real coming together of this worldwide group to officially look at robotics and electrophysiology.
Very exciting. What's been your experience with this robotic technology here at Intermountain Medical Center Heart Institute?
It's actually been really quite excellent. What we've shown is that the robotic technology, which in this case is a magnetic robotic technology, which allows the use of a floppy catheter within the heart instead of a stiff one, allows us to navigate through the heart in a much more exact way than we typically can with our hands. The catheter is floppy, so it can't poke a hole in anything, so the safety aspect is tremendous. Early on, it was really focused on procedures that were very difficult, procedures that were often unsuccessful using traditional techniques. And we very rapidly showed that this technology could be used to succeed where more traditional manual techniques had failed. From there, we actually grew into using it more every day. So really, I do basically all of my procedures with this technology. With regard to atrial fibrillation, the most common procedure we do here, we've actually published one of the largest case series looking at over 600 patients, half of whom had their procedures done with robotics, half with manual technology, showing that in 1 year and 3-year follow-ups, the outcomes were just as good with the robotic technology, that time of procedure was exactly the same, that X-ray exposure was actually a little bit lower with the robotic technology, that the safety factors were better. And so we're very excited about the ability of this technology to be used every day, not just for extreme situations. But we also do need to explore the barriers as well, including cost, et cetera. And so I think part of what we do here is to be on the leading edge of technology utilization. We're not necessarily the inventors here, although sometimes we are, but in this case we're not. We're also not the place where we do a lot of benchtop research, but what we are excellent at Intermountain is real-world, large population utilization. And looking at outcomes in that population really is what is translatable to the rest of the world. Because what's done on the benchtop or at a very small academic setting is very different than what happens in the real world. So we are really expert at being able to demonstrate to the larger management of these patients that these technologies can be used in a real world setting.
Well, very exciting. Looks like there's plenty of opportunity to learn more about these, explore these options. What days will you be presenting this information?
Sure. So the 4-hour SCRN symposium is on Tuesday afternoon, I believe from 2 to 6. Okay. And then the Rhythm Theater is on Friday at the actual floor of the convention center from 12:15 to 1:15.
Well, great. Thank you so much for being here today. We appreciate it.
My pleasure. Thank you.
Thanks.